everyone, it's Laura from Ortho Educator, and today we're going to talk about a few different orthodontic terms. So if you are going through orthodontic treatment yourself, or if your kid is in orthodontic treatment and you're accompanying them to the appointments and sitting there while the assistants and the doctors do their thing, you may hear all sorts of words going on and you're like, what are they talking about? And maybe you don't really care, but if you don't, you probably aren't watching this video. If you do though, this video is for you because we're going to talk through a few of those words. So I wrote down a few, so that's what I'm going to be looking down at. Okay, the first thing we'll start with is just a little bit about the braces. So with the brackets, your first experience with them would be like having the brackets placed. So you may hear the doctor say like, oh, more mesial or more distal. So mesial just means towards the midline of the face. So the midline of your face is right where your teeth, the center of your teeth are. So between your two big upper central incisors, that's your midline. So let's say that they're placing a bracket on a tooth, right? And maybe it's too far back and it needs to be brought closer, if it's on this side, closer to the front of your face, right? So that would be, oh, the bracket needs to be placed more mesial. So mesially, or the mesial is towards the midline of the face, and then the distal is the reverse of that. So that is towards the back of your mouth. So it's mesial and distal. And then when they're talking about, when they're talking about brackets, they'll call a bracket the same thing that they would call a tooth. And so there's going to be another video about numbering of teeth, and they're numbered differently, dental versus orthodontic. But if you hear the doctor say like, I need upper left 1, so that they are mentioning that and calling that, saying that they need the bracket for that tooth, right? So upper left 1 would be your central incisor, but on the left side. Piper, relax, lay down. Lay down. We're filming a video here, baby girl. Lay down. So orthodontically, we start with the incisors. Those are number 1, and then it goes back from there. 1, 2, 3, 4, 5, 6, 7, 8 being the wisdom teeth. And so if they say upper left 1, that's upper, so your upper jaw towards the left side, and then tooth number 1, or if it was, let's say you broke a bracket, you broke upper right 4, then it would be the upper jaw on the right side, but the bracket 1, 2, 3, the 4th bracket back, which would actually be your premolar. So anyway, that's just a little bit about kind of what maybe you would hear when they are placing your brackets. Other than that, you just hear them talking about like the different types of glues that they use, things like that. So then we'll talk a little bit about like while you're in treatment with your wires and bending the wires. So you may hear them throughout these 3 terms: FOB, SOB, and TOB. And you might be like, what, SOB? What is my doctor saying? Saying I'm an SOB? What? No. So FOB are your first order bends. SOB are your second order bends. And surprise, surprise, TOB are your third order bends. So when you go through orthodontic treatment, you have the brackets, you have the wire, and the wire has memory, and so the wire is expanding the jaw. But then, and where the orthodontist places the brackets helps the wires to pull on the teeth in certain ways. But once everything is pretty much straight, then the orthodontist may look and say, okay, well, this tooth just needs to be turned a little bit extra, but it's just that tooth. Or this tooth, it's a little bit low. It needs to be pushed up a little bit or brought down a little bit or whatever it needs to be done. So if he or she is having to move just 1 tooth, 2 teeth, 3 teeth, just a little bit, then they'll put bends in your arch wire to help specifically just move those teeth. So a first order bend gets us our rotations, right? So they might be stepping the tooth in a little bit or stepping it out, making the tooth like physically come in a little bit or come out if it was like too expanded or not expanded enough. So we have rotational movements and in-out movements with that. Second order bends, SOB, are our height differences. So, your 2 front teeth, let's say one was too long and they were needing to, step that tooth up. So height changes. And then third order bends are for torquing, and torquing is tipping the teeth. So, maybe you had a tooth that stuck out too far, and so a TOB would help to bring that tooth back into its right position. So those are FOB, first order bends, SOB, second order bends, and TOB, third order bends. You might also just hear the orthodontist say, I need to step up lower 2 to 2. So stepping up means just putting in like a second order bend, stepping those teeth up, making them higher, and then lower your lower jaw in 2 to 2. Remember, we have our 1s, 2s, 3, 4, 5, 6, 7, 8. So if he was doing lower 2 to 2, then he'd be doing the front 4 teeth on the lower, which would be your lower incisors, and scooching those teeth up just a little bit. So I know it can get kind of confusing, and I know you may, be sitting there at the orthodontist and just thinking like, what is he even talking about, or what is she even talking about? But I hope this helps you a little bit. You now know that he's not calling you an SOB. You have different bins that you put in the wire, FOB, SOB, and TOB. And then when, you're getting your brackets placed, or if you break a bracket, if you're getting it replaced, mesial, distal, that's just towards the front of the mouth, towards the back of the mouth. And that if you hear a bunch of numbers, watch my numbering video, but if you hear a bunch of numbers, they could either be talking about your tooth, or they could be talking about placing a bracket on that tooth. So, you might say like, hand me upper right 7. Well, that is for the upper, the right side, and the 7th tooth to the back, which is actually one of your molars. So anyway, if you have any other questions, leave them in the comments below. Hope this video helped you just to understand the world of orthodontics just a little bit better. Thanks so much and have a great day. Bye.